Hi, this is Dr. Cary Ganz, and I'm actually speaking to you from my office at home. I normally do these in the office at my dental practice in Garden City, but I had my last patient today came up and started asking some questions, and I was going to wait until maybe tomorrow or Friday or whatever, but I happened to have some time, and I got home, and before I forget, I thought I'd answer the questions. It was about dental implants. What are they, when are they used, and why? So that's what the topic for today is. What, when, and why? Well, what are dental implants? First of all, dental implant is a fancy screw. If you've ever put a molly in a wall, and don't ask me what that is because I'm not good at that kind of stuff, but if going to put a molly in a wall or a screw in a wall, that's a dental implant. It's a threaded device that is placed into the jawbone by typically an oral surgeon, a periodontist, or many general dentists, and it's placed in the jawbone. It's threaded in. It's done very precisely. It's done under very controlled circumstances. Now, years and years ago, we've been doing these for 30 years. Matter of fact, I was in charge of the implant fellowship program at North Shore Hospital here on Long Island. Now it's called Northwell. But years ago, we know when we did this, when they first came out in the 80s, that's 1980, not 1880, 1980s, we actually did these in an operating room. It was done under sterile conditions, and the patient had to be admitted, and it was a major event. Well, as with most things, that has changed dramatically. Now it's done in the dental office under local anesthetic, still in a very sterile, clean environment, because that's real important, but it's now under a much simpler methodology. It's done in the office, much like you would have any other dental procedure done. So the implant is basically threaded into the jawbone, they then sit there for a period of time. Now, years ago, they would sit for 6 months, 8 months. Now it's a lot less. Now we sit in the upper jaw 3 to 4 months, the lower jaw 3 to 4 months. It depends on the surgeon, depends on the bone, depends on the circumstances. But it's a 3 to 4 month process in order to get the implants to heal. They actually fuse to your jawbone. Incredible science, and they actually fuse. Success rates are, if done properly by trained people, are exceptionally high. Now, we're talking 95% or better. Now, that doesn't mean implants don't fail and doesn't mean there aren't issues. But for the most part, it's become a very practical and predictable type of treatment. Now, they're placed, and once after the period of time, the implant is uncovered. Typically, at least in the past, they were always placed under the gum tissue. So there was no pressure, theoretically, on the implant while they were healing. Well, nowadays, we sometimes leave them exposed. So when the implant's placed, you'll see a little metal healing abutment, healing collar poking through the gum tissue. What this means is that there's no need in the future to uncover that implant, because when they're buried under the gum during healing, the surgeon has to go back and uncover it, make a little incision to uncover it. So now we try to go ahead and leave them exposed a little bit, doesn't affect the success rates, so that it's a little bit easier on the patient. There's no second surgery involved. It just, once again, depends on the surgeon, depends upon their motivation, what their beliefs are. Sometimes, in the modern era, we actually load the implant immediately, which means the same day the implant goes in, there are times, depending on how rock solid that implant is, and there are ways of measuring it, that you can go ahead and put something on that implant the same day. You can put a temporary cap, depending on how many implants are there. We'll talk about that in a minute. You can actually go ahead and place a full restoration. This depends on the dentist, depends on the patient, the quality of the bone, the types of implants, the number of implants, etc. But it is done today. And so that there are times when we actually load the implant the same day. And they work very well. So that's the what. What are dental implants? Once again, just a fancy screw. That's all they basically are. And they're placed in the jawbone under very strict circumstances, and we're using very precision tools. Well, what is the when? When do we use implants? Well, we use them to replace teeth. Originally, they were invented to replace teeth only in the lower jaw, because typically lower dentures were not great. The tongue would move them around. You couldn't get suction for the most part. So lower dentures always were problematic. So they were really invented by P.I. Brannemark going back into the 80s in order to replace lower teeth. So you would place 5 implants at the time, and you would make a prosthesis that screws into the implants that is not removable by the patient, but removable by the dentist. So that if something happened, you could always take them out and make repairs, etc. And that would be the typical, we call it a fixed detachable, hybrid. There are lots of names for it. And, once again, depending on cost factors, depending upon motivation, patient's desires, You could place 2 or 3 implants and have a denture that snaps on. It's removable, but it has retention, which means that the denture would snap onto a bar or a snap or a button or something to help hold that lower denture in. Over the years, the whole implant philosophy has changed to the point now where we do entire jaws with fixed bridge work, with porcelain caps. Some amazing dentistry can be done. And you can have something that is quote-unquote permanent in nature, yet still repairable and restorable by us should something happen. My belief has always been that you want to be able to remove the prosthesis in case something happens. You see, the nice part about dental implants, if the restoration is placed on them, you can't get decay. It's a metal-to-metal joint. So there's no reason to cement these things permanently unless there are circumstances that demand it. But so you can always make them what we call retrievable, so you can get them off. This way it gives the patient a little bit of latitude. You don't have to worry as much if something does happen. There are usually ways that we can take these off, fix it, and put them right back on again. Lots of ways of using dental implants. You can use them so the why. The why do we use them? Well, we use them once again to replace missing teeth and to give patients back the kind of dentition that will enable them to function as a whole person again. You see, dentures really were never made to do that. You lose a certain amount of chewing function. You have hard plastic against soft gum tissue. With implants, that's no longer a necessity. So if you're wearing a denture that doesn't fit, or you have denture sores, or you're wearing a removable partial denture that's anchored onto teeth and causing those teeth to become mobile, you now can have dental implants placed almost with impunity. There are very few times that we cannot place them. Once again, whether you're local or whether you're in someplace remote, there's always a way to do this. It depends on what your motivations are as a patient. If you want implants to be placed, the dentist in your locality, typically if he or she can't do it, they can find somebody who can. There are very few circumstances today where we can't place dental implants and then place a restoration on that pretty much duplicates natural teeth. So you don't have to suffer with full dentures or partial dentures any longer. That's really the why. The why is to replace removable prostheses so you can start living a normal, natural life again, enjoying your food, tasting your food again, because with dentures sometimes that's difficult, and not have to worry about denture movement, dislodgement, and things of that nature. So that's the what, the when, and the why. Hope this makes sense. I hope I explained it a little bit. If there are any questions, I'm happy to answer them. If there's anybody watching this, I'm happy to answer it. If you find that you're local and you're in Garden City, New York, our offices are right across from Roosevelt Field, right across from the new Neiman Marcus. Give us a call at 516-741-1230. We'll be happy to chat with you about your implants. If you're having problems with current implants, there may be things we can do to help you. If you're contemplating implants and you haven't made that decision and you just need some advice, feel free to call us. You're happy to come in. No fee for the consultation. We'll be happy to chat with you and explain to you the pros, the cons, the if, the why, when, and where, and what, and whatever. So we'll be happy to chat with you. Additionally, because I do these Facebook Live things, you never know how many people are watching or shared. If you mention this video, we will give you $500 off on every implant restoration per implant. So if you have one implant, it's $500. If you have 2 implants, it'll be $1,000. We can hopefully save you some money. And at the same time, it gives me some feedback that people are actually watching this, because you just don't know. Facebook doesn't really give you that information. So once again, if you give us a call and you live local or you want to travel to Garden City, right in the middle of Long Island, just mention this video, mention Facebook, and we'll be happy to give you a $500 discount on each and every implant. Now, we don't place the implants. I work with a variety of surgeons who are very skilled. They place the implant. That's their business. But as far as the restoration of the implant, the cap, the bridge, the whatever, that's where I can give you that discount. I can't give you a discount off their fee. So I want to make that perfectly clear. We also have 12-month no interest financing, because implant dentistry can get quite expensive. It's just the nature of the beast. It's very complicated, very time intensive, and there are a great deal of components that are necessary that we have to purchase from manufacturers. And then the laboratory expenses are great, because the precision that you need to do implant dentistry correctly requires very skilled dental lab technicians. So when you put that all together, yes, implant dentistry can be expensive. So that's why I'm willing to give you $500 off per implant, per restoration, or whatever. We'll talk about that if you give us a call. I don't see any questions. If you have any comments or questions, I'll be happy to answer them. But we're getting past 10 minutes, and I don't like to keep these things too long. This will be up on the web. I appreciate if you do get to this point, that you like it, you share it, you let other people know, just basically for the information. If the information helps people in the Midwest or in California or whatever, then I've done my job as well. I do these things for a variety of reasons, the least of which is just to get the information out there. Patients ask me these questions all the time, and just answering them doesn't solve the problem. I like to have the best information possible, and this is just my opinion as to what, when, why, where, how implants should be placed, when they're placed, what they're used for, and the purpose behind it. Anyway, my name is Dr. Cary Ganz, once again. The Dental Spa, Garden City. We're here in the 300 Garden City Plaza, across from the new Neiman Marcus, Roosevelt Field, 516-741-1230. Thanks for watching, and please share this so other people can benefit as well. We're going to close this down, and we'll see you again on Facebook Live.